It is an inherited group of disorders where blistering of the skin develops to even slightest of minor injury. The skin shafts off, and it has four main types, as I said: simplex, junctional, dystrophic, and hemidesmosomal. Usually it happens when there is a consanguineous marriages. A mutation happens when relatives get married, and the child is usually born with any genetic disorder, and one of them is Epidermolysis Bullosa, where the child is born with a large bulla on any part of the body. It could be nails, it could be any part of the skin, it could be the scalp, it could be anywhere. And the recessive part, where both the parents are carrying the gene, is really difficult to treat. Chafing or wearing away of the skin, rubbing, or even increased room temperature may cause blistering. So depending on the type of EB, the severity differs obviously. Condition generally starts at birth, as I said. Most of these kids don't even celebrate their first birthday, and some do not even reach their 10th birthday. EB simplex is the most common form, and the one where homeopathy is proved to be really beneficial. Tends to be more severe when there is recessive form, right? And as I said, there can be deformities, there can be fusion of fingers and toes, contracture deformities, and even death. These are three main types you can see. Simplex, this is dystrophic, complete destruction of the skin. This is the junctional part involving the folds of the skin, where blistering happens at the folds. Child usually dies because there is, even in the alimentary canal, in the oral cavity, blistering is happening. Superimposed infections is usually the result, is the cause of the death in such cases. And it becomes extremely important that we are aware what we are dealing with. So, during the case you will see how we can do wonders with homeopathy. Anemia, esophageal stricture, eye disorders, infection during sepsis, loss of function of hands and feet, muscular dystrophy, periodontal diseases, severe malnutrition due to feeding difficulty obviously, and squamous cell skin cancer can all be the complications of epidermolysis bullosa. So coming on to the homeopathic approach, anti-miasmatic, importance of intrauterine history, clinical and palliative. Depending again upon the type of the disease that we are dealing with, the treatment approach matters. So this is the first case. This was my first case of EP as well. This was a 12 days old boy who was brought to me. He was a Fauji, he was a soldier's son, very low socioeconomic condition. And the boy was brought to me with complete peeling of the skin. Even slightest touch, the skin was coming out, right? The child was absolutely born normal, and on the 9th day, there appeared a big vesicular eruption on his left thigh. Fluid-filled eruption burst open the next day, and there was formation of thick yellow colored scabs. Skin started peeling off even on slightest touch. There was no discharge, no pain, child was seemingly in no distress. He appeared slightly pale though. It was a full-term vaginal delivery, and there was nothing, the pregnancy was completely uneventful. There was nothing to be really too sure about what to be given on. There was, even the intrauterine history had no such, complaints to be prescribed on. This was the boy. If you can appreciate the hands, the elbows, the face. It's a little unclear, but you can see the scabbing and blistering over there. It's not working. Let's see, maybe. Yeah. These are the legs. He was brought to me like this on the 12th day of his birth. You can appreciate his ears, the legs, the hands. This is his whole back. Complete chafing of skin. The medicine given was sulfur 30. During the day, Dr. Farooq Master said, even many stalwarts have always said, if you are unsure, start with an anti-miasmatic remedy. And when there are no such symptoms of distress also, so it looks like a psoriatic trouble. So sulfur 30 was the drug of choice. And as I said, we have to take care of the superimposed infections. So calendula mother tincture I advise for an external wash to take care of all the lesions that were happening. So child started becoming much better. This was just after the 4th day. Just on the 4th day, you can see the complete clearing of the abdomen. Face has reduced lesions. The hands are also started improving. The legs are improving. And this is by the 20th day. Completely, the lesions are gone. New skin has reappeared. No blistering appeared during this time. He was completely recovered. You can see the abdomen, the back, the legs, no lesion whatsoever, no blistering. This case lasted, I treated him, just one dose of sulfur 30 was given, and for external wash, I always recommended calendula mother tincture. And today this boy is 16 years old, hale and hearty, no medicine and completely fine, no remissions of blistering ever. Now this is the second case. This case took only 40 days. Now this case took almost 5 years. This is a case of a girl child from Hyderabad. Now she was brought to me when she was in extreme respiratory distress. They were in the ICU. The girl was in the ICU, and due to the complications of the Epidermolysis Bullosa, she was unable to breathe properly. They got her out of the ICU. And then they came to me. She developed blister on the second day of her birth, breathing difficulties and would not be able to eat anything. Mother had 2 miscarriages earlier and she was born through IVF. Mother also had gestational diabetes and she was put on insulin during pregnancy. Parents are distant relatives. As I said, consanguineous marriages is usually the cause. Baby lost some weight during the first 4 months. This is the respiratory distress that you can see. Can I have the volume, please? You can appreciate the breathing, even during sleep, or the difficulty in breathing. And just after 4 days of homeopathic intervention, right out of the ICU, the sound is almost gone. The breathing is much better. You can see she's sleeping much more peacefully. She had to be on the side to sleep better. She can now lie down on her back and sleep comfortably in just 4 days. And the remedy given at this point of time was just simply Sanket Gupta. And she responded beautifully. So, as I said, it took 5 years for her to be completely taken off the medicines. The medicines used during this time period was cephalium, Merxol, Condurango, Antimtar, Sambucus nigra, Tibocline, sulfur 30. During the course of the stages, in such cases, it cannot be only just constitutional treatment. It can be an amalgamation of medicines depending on the pathological state of the disease. And this is her now, completely fine, no remission. She's completely off medicines. And these are some of the cases I'll quickly share. Epidermolysis bullosa. This boy was just given Cinna. The only symptom I had was he's eating mud. So just given Cinna and the blistering was completely gone. This boy was when he was brought to the clinic, it was a pungent smell coming out of his scalp. So just Pyrazine 30 was given to subside the superimposed infections, and he was completely fine with that dose. These are all not, I would say these are all cured cases, but how homeopathy has helped them, at various stages of the disease, and we can make their lives definitely better. This is one scope of area that we don't really take up, the genetic diseases, but we should take up. This boy in Canada, he was given phosphorus. If you can see the lesion on the back, you can see different lesions on his neck and all, but that back area is completely gone. This is a patient from Germany, complete dystrophic blistering, complete skin gone. She had to be taped all through. She had to be taped all through, and syphilinum held her. This boy in Israel, he was 15 years old when he was brought to me, and for 15 years he never had a spotless face, if I can put it that way. In just 2.5 months of homeopathic medicines, this is the result we achieved. And till now he's on medication, but no relapse has happened. But we are still on medication and continuing with the treatment. Thank you so much for your patient listening. Thank you.